You've had one, right? I mean, pretty much everyone has. That little fiery spot inside your mouth that makes everything eating, talking, just a little bit awful. Yeah, we're talking about mouth ulcers. But what if that little sore is more than just a random pain? Let's get into it. So, think of this as a little detective story. That ulcer, that's our first clue. And our job, together, is to figure out what it's trying to tell us. Sometimes the answer is really simple, but other times it's the very first piece of a much, much bigger puzzle. And this is a clue that shows up a lot. Seriously, look at this number. About a quarter of the entire global population gets these things recurringly. So if you get them, you are definitely not alone. The real question is, what kind is it and what is it saying? Okay, so first things first. Before we get into any of the wilder theories, let's talk about the most common and frankly the least worrisome reasons you'd get an ulcer. We've got to establish our baseline for what's normal. So what is an oral ulcer, technically? Well, it's actually pretty straightforward. It's just a break, a little hole in the protective lining of your mouth, that mucosal layer. And that break exposes all the sensitive stuff underneath, which of course is why it hurts like crazy. So what causes that break? Well, most of the time, it's something really simple. These are the usual suspects. Maybe you just bit your cheek. We've all done it. Or you've got braces rubbing or a sharp tooth. Could even be a chemical thing, like holding an aspirin against your gum, or the classic, the pizza burn from biting into food that's just way too hot. And the number one offender of them all, it's these guys, recurrent aphthous ulcers, or as literally everyone calls them, canker sores. These are the little guys that pop up for no obvious reason and aren't tied to some bigger disease. And here's the key thing to remember. They almost always pack their bags and leave on their own in about 10 to 14 days. This is our benchmark for normal. Right. So if a canker sore that vanishes in 2 weeks is normal, when does it stop being just an annoyance and start becoming a real clue, a sign that something else might be going on in your body? And here it is. This is probably the single most important sentence in this entire explainer. The official guidelines are super clear on this. If you have a mouth ulcer that is still hanging around after 3 weeks, it is time to see a doctor or a dentist. Period. That's the turning point. This quote just says it all, doesn't it? An ulcer that overstays its welcome, that goes past that 3-week mark, it's not just a sore anymore. It's your body basically raising its hand and saying, hey, I have a question here. And that's a question a professional needs to help answer. So when you go to that professional, where does the investigation lead? Well, one of the first places they look is the immune system. Because sometimes that little ulcer in your mouth is just the local sign of a much bigger body-wide issue, especially with autoimmune conditions where the body starts attacking itself. And this chart is a perfect example of what I mean. Take something like lupus. Sure, you get oral ulcers, but they show up with other clues, right? Like a specific rash or joint pain. Same for Behçet's disease. The oral ulcers are a huge part of it, but they're joined by other really serious signs. You see, in both cases, the ulcer is just one piece of that bigger puzzle. Okay, now we do have to talk about the most serious possibilities. It's much less common for sure, but a persistent oral ulcer can absolutely be a warning sign for some major diseases, and that includes cancer. And this, right here, is why that 3-week rule is so incredibly important. An ulcer that just will not heal can be one of the very first signs of squamous cell carcinoma. And that's a big deal, because it accounts for a whopping 90% of all oral cancers. It might start looking like a little patch or just a sore that refuses to go away. Now, what's really fascinating and kind of wild is how a symptom in your mouth can point to a cancer somewhere else entirely. With lymphomas, for instance, doctors are on the lookout for a very specific trio of signs called B symptoms. We're talking about a fever you can't explain, night sweats that are so bad you have to change your sheets, and losing a lot of weight without trying. An oral sore could be one sign, but when you see it paired with these other red flags, well, that tells a much bigger story. And honestly, the list of connections just keeps going. Oral ulcers can show up with inflammatory bowel diseases like Crohn's. They can be a sign that you're low on things like iron or B vitamins. They can even be an early clue for celiac disease or a side effect from really common medications. It really drives home how much your mouth is connected to the health of your entire body. Okay, so after all that information, which I know can be a little intense, what's the takeaway? The goal here isn't to make you worry, it's to empower you. So what's the simple, practical, non-anxious plan? Let's just break this down into a really easy action plan. Step 1, observe. Just look. Look at the ulcer, sure, but also check in with the rest of your body. Anything else feel off? Step 2. Note. Keep track of the time. Is it sticking around past that 3-week mark? And step 3. Consult. If the answer to that question is yes, or if you've noticed other weird symptoms popping up, it's time to talk to someone. That's it. It's that simple. And that is the absolute bottom line here. This is not about freaking out every single time you bite your cheek. It's about shifting your mindset from worrying to just being aware. Your body talks in patterns. A single ulcer is just an event, but ulcers that keep coming back, or one that won't leave, or one that brings friends, that's a pattern, and patterns are always worth listening to. So the next time you feel that familiar little sting in your mouth, you'll know what to look for. And it kind of leaves you with a bigger question, doesn't it? What other seemingly simple things, a headache, a rash, feeling tired, might be our body's way of trying to tell us a much more complex and a much more important story?